All right, guys, now we get to dive into some really good, really important cranial nerves 2 and 3, so get ready to rock and roll. All right, so as we go into cranial nerves 2 and 3, I want to ask you some big picture points before we get going, okay? If I asked you, where does cranial nerve 2 go? You'd be thinking, first of all, what is cranial nerve 2? It's axons, the ganglion cells. You know that, first of all, they're traveling all the way back here to the occipital lobe, right? So one answer to that would be LGN back to V1, which is in the occipital lobe, right? The other name for V1 would be Brodmann's area 17, or the striate cortex, okay? So first thing is LGN to V1, yes. Number 2, you're thinking for pupils, pretectal for pupils. Say that aloud, connect the P's, pretectal for pupils. Last but not least is the superior colliculus for saccades, right? Pretectal pupils, superior colliculus for saccades, right? You might remember that saccades are done by frontal eye fields and the superior colliculus, okay? If you haven't thought of that in a while, don't worry, we'll cover that later. But I want to make sure you think of cranial nerve 2 as going to 3 destinations. I'm going to map out a picture in a second to talk about that. When we get to cranial nerve 3, where does it start its course? Do you remember? The midbrain, yes. You guys remember how many extraocular muscles cranial nerve 3 innervates? You're going to say 4, right? 4 of the 6. What else is cranial nerve 3 going to do? It's going to do what? Thinking, anything come to mind? Yes, you're thinking the levator, right? So it's going to open up the eye, and you also know it's going to be responsible for accommodation and meiosis, okay? Now, one last thing I want to mention is every time you check someone's pupils in clinic, okay, you're shining a light in the eye, cranial nerve 2 is going to bring that message back, right? And then the actual response where the pupil constricts, that's going to be cranial nerve 3, okay? So when you picture all that together, like how all that works and how to process all that, we can do that in a picture, okay? And we're going to start that picture with cranial nerve 2, and then I'm going to add cranial nerve 3 to it after we build our foundation. So let's check that out now, guys. Okay, guys, as we break down cranial nerve 2, we're going to talk about each one of them individually here for a minute. We've got the right optic nerve, and we've got the left optic nerve, all right? And if I asked you guys which fibers cross, all of you guys would say, I know that, Kyle. I know it's the nasal fibers. So we're going to make the nasal fibers of the right eye cross. We're going to split this optic nerve in half, okay? And we're going to make the nasal fibers of this cross as well, okay? Split that in half like this. These fibers are going to cross just like that, okay? You guys know that temporal fibers do not cross. They extend like this. And where are those fibers going, guys? If I asked you, all of you would say it's going, I'm going to put it in red right here, make it real prominent. It's going to the LGN. All right, those fibers are headed to the LGN. All right, so I'm going to put LGN. Hey, by the way, we're going to get to this in a second, but if I said Edinger-Westphal nucleus, does that anything come to mind for that? Edinger-Westphal, I want you to think cranial nerve 3, which we're going to get to in a minute, okay? Cranial nerve 3, it's going to be in the midbrain. Right now, we're talking about cranial nerve 2. We're saying that when we shine light in the eye, a lot of that light, or just information we read, is being absorbed by cranial nerve 2. It's going to the LGN, and then from the LGN, it's taking it right over here to V1. Okay, V1, also called striate cortex or Brodmann's area 17, okay? But don't miss this, guys. It's a big moment right here, okay? This is a moment that confuses a lot of people. When these fibers right here go down here to the LGN, right, and these nasal fibers cross like this, not all of these collection of fibers make it to the LGN. Let's say right around here, those collection of fibers exit, okay, and a third of them exit, and they head down here to the pretectal nucleus, okay? When we talked about cranial nerve 2, we said it goes to 3 places. One is V1 right here. We said another one was right here, pretectal. And the third one was where? Superior colliculus for saccades. So on both sides, okay, these fibers are going to exit and go to the pretectal nucleus. Big deal, okay? Pretectal for pupils, pretectal for pupils. But when I say pupils, I want you to think light response. Light response. Remember, there's a light response and a near response. Whenever we're talking about pretectal, you can even write the word out like this if you want. Pretectal, I want you to circle that L at the end of the word and think pretectal for light response. Meaning, when we shine the light in someone's eye in clinic, this is the pathway that's going on. All of the things that I've just drawn right here is cranial nerve 2. Now we're done with cranial nerve 2. That's what you need to know about cranial nerve 2, is it takes information back to V1. It also takes information to pretectal nucleus, okay? Now, if we want to go a little step further, okay, this is what I'm getting ready to draw is not cranial nerve 2, okay? It's a connection, though, between the pretectal nucleus, which is going to send a connection here to both sides, okay? And I'm going to put this in green, all right, because it's money. You're going to get this right on board. You're going to nail it. The pretectal is going to connect with the Edinger-Westphal. And as soon as I say Edinger-Westphal, what cranial nerve are we at now, guys? What cranial nerve are you thinking about in your mind? You're thinking about cranial nerve 3, baby. cranial nerve 3, okay? Because we said cranial nerve 3 starts at the Edinger-Westphal nucleus, okay? So once it gets here, once the information goes from here to here, right? From here to here, once we're at the Edinger-Westphal nucleus, now we are officially in the midbrain. We are at cranial nerve 3, put like 10 stars around that. That's what you want to think about, okay? So what I'm going to do is give a clean start right now to this board, and I'm going to tell you what happens next as we get into cranial nerve 3. All right, guys, so when you look at this, I want to give you like a focused in view of the midbrain here for a minute. You guys know, again, this is where cranial nerve 3 nucleus is going to be. So we have a cranial nerve 3 nucleus on the left side of the brain and one again on the right side of the brain, okay? And remember, these cranial nerve 3 nuclei are loaded. They have Edinger-Westphal fibers, right, which I showed you on the previous diagram. But I want to show you all the things: superior rectus, medial rectus, inferior oblique. Remember, you want to think of each of these nucleus, like all of this information from this nucleus, for example, pretty much all of it is going ipsilateral. Because when you think cranial nerves, you want to think ipsilateral, okay? Always want to be thinking about ipsilateral when you think about those, okay? There was one exception, which we said the superior rectus goes contralateral. So on both sides, superior rectus is going to be the one that crosses. So I want you to kind of write in your margin, if you want to say contra SR, right? Contra SR. Remember, superior oblique was the entire cranial nerve that decussated as well, okay? So you want to think contra SR, contra superior oblique, okay? The one other thing that's kind of special about this, I'm going to put it in blue, okay, to really make it sink in, is if you looked at these nuclei individually, you'd say, Kyle, you're missing something. And you'd say the thing that you're missing, okay, is going to be the levator, okay? You'd say there's levator is missing. I'm going to put levator right here in the middle, because you're going to learn as you look in the text that levator only has one nuclei. There's not a left and a right, and that one nuclei right here shoots to both levator muscles on both sides, okay? So when you think about how they could ask that on the test, okay, this one levator shoots to both sides. If you have a nuclear lesion, I'm going to put this in red, of the levator, okay? If you go like that and knock out the levator, okay, then you're going to knock out the levator on both sides, right? So if you have a levator lesion, all right, it's going to cause a bilateral sudden onset. That's the key word, sudden onset bilateral ptosis. Is it a small ptosis or big ptosis, guys? You're like, it's a freaking huge ptosis, Kyle, right? Because it's 15 millimeter ptosis. Remember, Mueller's sympathetic muscle innervated 2 to 3 millimeters, okay? Levator, big ptosis, 15 millimeters. Okay, so I wanted to show you again, when you think about the midbrain, which is hard to picture, I want you to picture this Edinger-Westphal nucleus as being a part of a bigger nucleus with all these other fibers, okay? That's how you want to picture what's going on at the level of the midbrain with cranial nerve 3. Remember, cranial nerve 2 pulls the information back. Cranial nerve 3 is what's going to provide the pupillary response, okay? And you might remember in the previous diagram, I'm just going to add to this right now, we had a pretectal nucleus right here, for example, shooting to both Edinger-Westphal. Do you remember that? Well, if we want to complete this diagram, what we would do is Edinger-Westphal then is going to send it to the ciliary ganglion, okay, and ciliary ganglion is going to shoot it onto the eye, okay, on both sides. So over here, again, Edinger-Westphal is going to shoot it up here, okay, to the ciliary ganglion. Ciliary ganglion is going to shoot onto the eye, okay? So if they ask you on boards, this is hard, okay, so hang with me. You might even have to push the 15-second button after I say this because it's a mouthful. But if they ask you where do preganglionic parasympathetic fibers start their course, preganglionic, parasympathetic, you're going to say right there the Edinger-Westphal. So preganglionic fibers are from Edinger-Westphal to ciliary ganglion. Postganglionic are from ciliary ganglion on. I'll draw you another diagram at the end to reinforce this. But again, where do preganglionic parasympathetic fibers start their course? You're going to say Edinger-Westphal. Ciliary ganglion onto the eye is going to be postganglionic. Now, we're not going to get into neuro right now, okay, because you're going to have a whole section of neuro later. But I just want to point out that when you look at this, again, we'll reinforce the details later, but a lesion right here, okay, is called Adie's tonic pupil. A lesion here, in between the pretectal and Edinger-Westphal, is called what? Anything come to mind? You're thinking Argyll-Robertson pupil. And it makes sense when you think of Argyll-Robertson because what do we say about the pretectal nucleus? What type of response does it do? It does the light response. So if Argyll-Robertson knocks out that, guess what? These patients are not going to have a light response. When you shine light in their eyes, there's going to be no response. They're going to have these little myotic pupils that don't respond to light. Okay? So again, hopefully this pathway now makes sense. Cranial nerve 2 brings the light back. And some of it goes to the pretectal nucleus. The pretectal connects to Edinger-Westphal. The Edinger-Westphal, right, once you get to that moment, you're now considered a part of cranial nerve 3. From that moment on, that's where you get the efferent response or the motor response, where Edinger-Westphal connects to ciliary ganglion connects to the eyeball. So as you look at that, guys, I talked to you about the nuclei of cranial nerve 3, right? Hopefully you stayed awake for that. But I want to talk to you about actually an aneurysm of cranial nerve 3. You guys know that cranial nerve 3 is now loaded with fibers, right? And as you think about that cranial nerve 3, the kind of the sketch you want to have in your mind is this nuclei, this actual cranial nerve 3 is real thick. If I were to show you from this angle, right, you would see this real thick nerve, right? And then you guys remember the pupillary fibers are on the outside, right? So if there's something pushing on the outside of cranial nerve 3, imagine it's like a cord right now, right? If there's something pushing on the outside, it's going to push on those pupillary fibers, right? And so if that ever happened, right, your patient would present with an eye that's down and out, right? And you shine light in the eye, they get no pupillary response. You're panicking, right? Because you're thinking there's an aneurysm, right? And so if there's an aneurysm, I know you've had this hammered in school, makes for a great board question. Okay, you're thinking the aneurysm is in the circle of Willis, and it's where, guys? It's at the connection between the internal carotid artery, yes, and the posterior communicating. Don't put cerebral on boards. Posterior communicating artery, right at that intersection. You guys remember that when we drew that out earlier? On blood supply, that's where the lesion will be located most likely, right? So that's an urgent situation. And if I had to ask you right now, just to review a little bit, okay, what are the branches of the internal carotid? Is that a pick 2, pick 3, pick 4 question? When it comes to the circle of Willis, you're thinking that's a pick 4, right? What are those branches? OPAM, right? The O is ophthalmic. That's going to the eye. How many branches does the ophthalmic have, guys? 7 major branches, right? CL, like contact lens, MIS, LACI, LSE, right? Those are the main branches. Okay, so again, internal carotid has how many branches? 4. The first one's ophthalmic, next one's posterior communicating, there it is. Next one's anterior cerebral and middle cerebral, okay? Again, I just want to give you a lot of repetition. I know how critical that is to making sure you get this, guys, because the one thing that our team has seen consistently over the last decade of doing this is that, you know, it's not that only the smart people pass this test. There's a lot of students, right, that are looking at me right now asking the question like, am I smart enough to pass this? I hope I'm smart enough to get this. And if I could talk to you personally right now, I would say, if you're asking yourself that question, that's not the right question to ask. And I say that with all like the sincerity and like passion I have within me, because this is what drives us so much, is that this is not a test of intelligence, okay? It's a test of preparation. And every single person listening to this can pass this test. You can do this, okay? Especially when you break it down into bite-sized chunks. You can absolutely dominate each one of these sections, right? And really get to a point where after you've heard the repetition and had it multiple times, right? You can take this to a whole nother level, okay? And that's why we've broken down the curriculum like we have with all these bite-sized chunks, and then giving you the ability, if you're the type of learner who says, you know what, I just want to be like quizzed, like I'm at a Starbucks with someone. I just want someone to like constantly quiz me back and forth. That's why we did the flashcards, right? And we have all that coaching on the flashcards. It's not just a question and an answer. It has a lot of different coaching as part of that. And we have basic flashcards and advanced flashcards to kind of help reinforce things, right? That's why we wrote all the test questions, right? Because we know everyone is going to approach this a little differently, right? So again, I want you to hear me say that over and over. It's not a test of intelligence. It's a test of preparation. And we're all about figuring out the best way to prepare, help you prepare, right? Trying to give you the scaffolding. But what's going to determine if you pass is how much you dive into this, right? It's after you watch these videos, how much does your curiosity take over, where you just say, I want to be an unbelievable doctor, and you keep diving in, adding layers and layers and layers. I think of it like an onion, right? The student who's just amazing on this test isn't the smartest. It's the one who's continued to add layers to their knowledge to a point where by the time boards comes, it's like, man, you got to peel and peel and peel because they've made connections from so many sections. This person's unstoppable. Their knowledge is incredible. And really, when it comes down to it, that's really the type of doctor our patients want to see, is a person who's taken that extra step to say, you know what, I'm going to spend the rest of my life doing this. I don't want to be average at anything, but especially what I'm going to be spending the rest of my professional career doing. I want to be unbelievable. And that's the message we keep wanting to encourage you to process. It's just going after it. It's just adding layers, being the best doctor you can be. And oh, by the way, I happen to crush a test along with it, right? That's what we want to go after as a team, okay? And that's what I want to help you as we go through this together, okay? So guys, hopefully that's helping you. Hopefully you're feeling like, I got this, I can do this. Go ahead and take a quiz on this content. Make sure you're ready to rock and roll, and then we'll jump into the next portion of cranial nerves.